Hi, I'm Dr. Mary Fu, and I'm a naturopathic doctor. I have a private practice based in Portland, Oregon, where I see patients in person and virtually for women's health and natural fertility. Today in this video, I'll be talking about hormone testing. If you're watching this video, chances are that you've already thought about hormone testing and probably wonder what your levels might be. Maybe you're thinking about having a baby, maybe you have some health issues and you really think that hormones might be playing a role. Whatever your situation might be, I hope that this video can provide a good starting point for you to have an informed conversation with your healthcare provider about hormone testing. So today I'll be going through each of the hormones that are important in evaluating fertility, their role in the female body, and then we'll talk about different testing methods, some pros and cons to the different ones, as well as one of my favorite ways to test hormones. And at the bottom of the video, you'll find a downloadable PDF that has a list of the hormones I'll be talking about, as well as optimal reference ranges for blood testing. So let's dive in. So today I'll be talking about sex hormones, estrogen, progesterone, and testosterone, adrenal hormones, cortisol and DHEA, thyroid hormones, and I'll briefly also mention pituitary hormones that come from our brain, FSH and LH, as well as AMH, which is a marker of ovarian reserve. So first up, progesterone. Progesterone is often thought of as the pregnancy hormone. Let's look at the word progestation. This hormone is responsible for helping us sustain a pregnancy. Actually, one common cause of early miscarriage is insufficient progesterone. So it's important to check out our values before we jump into a pregnancy. Estrogen. This one gets blamed a lot for PMS symptoms. You've probably heard the term estrogen dominance. So we think about estrogen being associated with things like breast tenderness and moodiness and headaches, especially around our menstrual cycles. But when it comes to fertility, estrogen is indispensable. It is the builder. It grows our uterine lining to prepare for implantation. And this is what we shed when we have our periods every month, hopefully, and when there's no fertilization that occurs. And estrogen also supports our breasts. It helps us prepare for breastfeeding. And it supports our bones, our brains, and our heart. And this prepares us for the physical, mental, and emotional task of caring for a new baby. So even with elevated levels, that can be seen as a sign that something might not be right in our body. Maybe it's telling us that we're not making enough progesterone. So estrogen and progesterone feed back on each other throughout the month. So it's important to test these together to see what might be happening, to get a better understanding of how our levels can be more in balance throughout the month to prepare for pregnancy. Testosterone is often thought of as a male hormone, but we all have it, females and males. In female bodies, it's really important for the early stages of follicle maturation. So this is a process by which the eggs in our ovaries mature every month, and at the end of this process there is a dominant egg that emerges and ovulation occurs. So if our testosterone is low, the follicles may not mature properly, and so they may degenerate, or if they do mature, they are often of poor quality. So testosterone also plays important roles in bone and brain health, as well as in energy and libido. So all of these things we really want for pregnancy and for postpartum. And DHEA is interesting. It's also considered a male hormone or androgen, but it's really made primarily by our adrenal glands. And one of its main roles is to serve as a precursor to testosterone and estrogen. So how much DHEA we make naturally declines with age. And because of this property, it's been studied a lot for ovarian reserve and for egg quality, both of which also decline with age. Studies show that DHEA can help improve IVF success rates as well as increase chances of natural conception. And in blood, we often measure the sulfated form, DHEAS, because this is a more stable marker and it doesn't have a diurnal pattern or levels that change throughout the month. So we already know a little bit about what happens when DHEA and testosterone are low. So when these two hormones are high, they can also be problematic. They can indicate increased stress, inflammation, and are often associated with things like PCOS, ovarian cysts, body and hair growth, insulin resistance, irregular menstrual cycles, and of course, infertility. So these two hormones are important to test together and to evaluate in anyone who's thinking about having a baby, especially if you're experiencing any of these symptoms. Okay, next up is cortisol. Cortisol is a really great marker that helps us understand how we're responding to stress. You probably intuitively already know this, but excessive stress is not good for having a baby. If our body thinks that we're running away from a tiger, it's going to prioritize survival over reproduction. And so what's going to happen physiologically is that the body is going to suppress ovulation and our cycles are going to become irregular, if not stop altogether. And also people who are stressed just tend to engage in less healthy behaviors. They have sex less often, which is neither of which are great for making a baby. And finally, last but not least, thyroid hormones. So the thyroid helps us regulate our metabolism, and this is a process by which we convert what we eat and drink into energy. We don't necessarily think about thyroid as directly relating to fertility, but I would argue that this is one of the more important markers to test for. And this is not only because thyroid helps us regulate our menstrual cycles and improve sperm quality in men, but it also, if we're low in thyroid hormones going into a pregnancy, it can lead to birth defects. So because thyroid disease is so prevalent these days, I like to run a thyroid panel in my patients, especially if they're having symptoms, struggling with fertility, and or have a family history of thyroid disease. All right, thanks for staying with me so far. Let's get into testing, which is why you're here. So there are a few different ways to test for these hormones. Blood is the most conventionally accepted testing method, and that's what you're gonna get in most fertility clinics if they work you up for a fertility case. It provides a good picture of a lot of hormones. I didn't talk about these yet, but the pituitary hormones, FSH and LH, those come from our brain and talk to our ovaries to tell it to ovulate and to have the estrogen progesterone cycles that it does. Blood can also be a really great way to evaluate for estrogen in the first half of the cycle, and these three hormones are often tested together on day 3 of a menstrual cycle, and you'll see what the optimal levels should be in blood for these hormones in my handout below. Similarly, progesterone can also be measured in blood pretty reliably. And this is usually done in the second half of the cycle, usually on days 19 to 21, when it's supposed to be at its peak. Blood can also be a really great way to test DHEA and testosterone, and it's often considered the gold standard when it comes to these two male hormones. It's also standard practice to test thyroid hormones in blood, and this is usually done in the morning when thyroid hormone levels are at its highest during the day. And then finally, I also didn't talk about this hormone yet, but it's the anti-Müllerian hormone, AMH, and it's a marker of ovarian reserve or egg quantity, and this usually declines with age, and this marker can help decide if someone is a good IVF candidate. All right, so you're thinking, so you should just get all these hormones tested in blood, right? So where it gets tricky with blood testing is with irregular cycles. Hormones like estrogen and progesterone have a monthly pattern, and testing them in blood on days 3 and 21 are based on that 28-day cycle. So if you don't have a regular cycle, and that's maybe one of the reasons why you're struggling to get pregnant, blood may not be the right way to go necessarily. This is where urine testing can come in handy. I like urine testing for a lot of reasons. One reason is the convenience. So it's a lot easier to pee on a strip than it is to schedule a blood draw, go in for one, and maybe have to go back if the timing wasn't right. And the second reason is that it can give us a look at our hormones either throughout the day or throughout the month. So this is a little bit more comprehensive than a point in time during the day, like in blood. And the third reason is that it allows us to not only see the hormones themselves, but also their breakdown products. And I'll talk more about that in just a minute. One of my favorite ways to test for hormones is using the Dutch test. It provides a pretty comprehensive look at our hormones, estrogen, progesterone, DHEA, testosterone, as well as cortisol. And it looks at our metabolisms of these hormones. So this is important because, for example, estrogen can be metabolized down a number of different pathways. And some of these pathways can be associated with more menstrual cycle symptoms, more PMS symptoms, while other pathways can be unstable and undesirable and actually can cause DNA damage if allowed to accumulate over a long period of time. So this is where urine testing is really helpful for looking at how we're breaking down our hormones as well as their overall levels. We can also look at cortisol in saliva and urine on the Dutch test. So both of these are valuable ways to look at our stress response throughout the day. So cortisol has what's called the diurnal pattern. So its levels are often highest, or it should be highest ideally in the morning, and they decline with the day. And an ideal pattern might look something like this. So if we test cortisol and we see inappropriate elevations or low points throughout the day, that might provide a really good clue into what's happening with a person's stress response and their adrenal gland health. Finally, one of my favorite features of the Dutch test is their cycle mapping test. So this allows us to look at fluctuating levels of estrogen and progesterone throughout the month. It helps us answer the question whether estrogen is peaking appropriately in the first half of the phase and whether progesterone is peaking appropriately in the second half of the phase. So in summary, here are the ways I like to test each of the hormones I discussed while evaluating fertility. So in blood, I like to test FSH and LH. These are the hormones that come from our brain and talk to our ovaries. Blood is also great for estrogen and progesterone if we have regular cycles. But if you're symptomatic or if your cycles are irregular, it might be worthwhile to consider something like urine testing. Testosterone and DHEA are great either in blood or in urine, and cortisol ideally in urine or in saliva, so that provides us a good look throughout the day at different points in time throughout the day. And then thyroid hormones are best in blood, and so is AMH, the marker of ovarian reserve. All right, and that brings us to the end of our time together. If you have any questions about any of the content, please don't hesitate to reach out. My contact information is here. I will reply, I will respond. And I hope you learned something valuable from this video and you're able to either use the information for yourself or bring it to a healthcare provider on your fertility journey. So I wish you the best of luck and take care and be well. Bye.